The NHS, a cornerstone of British society. Free at the point of use, a beacon of universal healthcare, it has saved millions of lives, offering care to all, regardless of wealth or background. But beneath this revered institution lies a growing crisis. Every day, doctors, nurses, and healthcare workers push themselves to the limit, trying to keep the system afloat. In recent years, headlines have painted a bleak picture. Overwhelmed hospitals, staff burnout, record-long waiting times, patients unable to get appointments, ambulances queuing for hours outside A&E, operations delayed for months, sometimes years. The NHS is facing pressure like never before. How did we get here? What led to this breaking point? And most importantly, can anything be done to save Britain's most cherished institution? The question is the NHS on the verge of collapse? Let's break it down. The pressure on the NHS. Every winter, the NHS faces its toughest battle. Flu outbreaks, an aging population, and more recently, the fallout from the pandemic. Hospitals report being at full capacity, ambulances queue outside A&E, and patients are waiting hours, sometimes even days to get a bed. The numbers tell a troubling story. Right now, over 7 million people in England are waiting for elective procedures. GP appointments are harder to get than ever, and emergency response times are soaring. This isn't a sudden crisis, it's been building for years. These delays are more than just numbers, they are real-life consequences. Patients are waiting over 12 hours in A&E before being seen. Non-urgent surgeries, such as hip replacements or cataract operations, are postponed indefinitely, leaving people in pain or unable to work. Life-threatening conditions like strokes and heart attacks face increasing delays, where every second counts. It's not just hospitals under pressure, GP services are overwhelmed too. Many patients struggle to get an appointment for weeks, pushing them to A&E, further straining the system. Pharmacies are struggling with medication shortages, complicating care for both patients and healthcare workers. In Manchester, a father of two waited 16 hours in A&E with a severe infection. In Birmingham, a cancer patient's treatment was delayed by 6 months due to backlogs. In London, an elderly woman was told to wait nearly 2 years for a knee replacement, leaving her housebound. These stories echo across the country, highlighting a healthcare system struggling to meet the needs of its people. And the mental health crisis compounds these pressures. NHS mental health services are overstretched, leaving thousands without support. Young people with severe conditions are waiting months for specialist care. This isn't just a healthcare issue, it's a public health emergency. The financial strain is staggering. Billions are being spent to manage backlogs, hiring costly temporary staff to plug workforce shortages. Hospitals are forced to divert funds away from long-term improvements just to stay afloat. Then there's bed blocking. Patients who are medically fit for discharge remain in hospital because there isn't enough social care to support them at home, reducing available beds for incoming patients. It's a vicious cycle affecting every part of the NHS. NHS staff, meanwhile, are bearing the brunt. Burnout, anxiety, and depression are widespread, with many professionals choosing to leave the profession altogether. This exodus further exacerbates staffing shortages, creating a vicious cycle that undermines the system. The NHS has faced crises before and bounced back, but the scale of the current challenges begs the question, is this just another rough patch, or are we witnessing the slow unraveling of a system that's been the backbone of British society for over 7 decades? Understaffed and underfunded. Staffing is one of the NHS's biggest challenges. There are over 100,000 vacancies across the service. Doctors, nurses, paramedics, all stretched thin. Many are leaving for better pay and conditions, while those who remain are overworked, exhausted, and struggling to meet the rising demand for care. Imagine a hospital ward designed for 10 nurses, but only 6 are available. This means longer waits, more strain on each worker, and a higher risk of errors. The cracks in the system are widening. The NHS relies heavily on international recruitment to fill these gaps. However, post-Brexit immigration changes have made it harder to attract foreign healthcare workers. Many EU doctors and nurses have left, and fewer are coming to replace them. Meanwhile, homegrown professionals are moving abroad for better pay and working conditions. The staffing crisis isn't just confined to hospitals. Ambulance services are critically short on paramedics, leading to dangerous delays in emergency response times. GP surgeries are overwhelmed too, with some areas seeing one doctor for every 2,000 patients. This drives even more people to A&E, further straining an already overstretched system. Strikes have become more frequent. Nurses, junior doctors, and ambulance workers demanding better pay and conditions. They argue that years of below-inflation wage increases have pushed them to breaking point. And while government spending on health has risen, many argue it's still not enough to meet growing demand or fix deep-seated inefficiencies in the system. The NHS's workforce is its backbone. Without sufficient, well-supported staff, no amount of funding or restructuring will prevent further decline. The question remains, will policymakers act before it's too late? Systemic issues and privatization debates. Beyond staffing and funding, deeper systemic issues plague the NHS. A rapidly aging population and increasing demand for care have left the NHS struggling to keep up. Social care services are underfunded, creating bottlenecks that trap elderly patients in hospitals, unable to be discharged due to a lack of available care at home. Technology and infrastructure are also outdated, causing inefficiencies that slow down care. While other healthcare systems embrace innovation, such as AI-assisted diagnostics and digital patient records, the NHS remains burdened by paper trails and outdated systems. The debate around privatization has intensified. Some argue that more private sector involvement could ease the strain on the NHS, increase efficiency, and reduce waiting times. Others warn that this could create a two-tier system where the wealthy get faster, better care, leaving NHS patients to endure longer waits and subpar services. We're already seeing a shift. Private GP services offering same-day appointments for a fee, and more people turning to private health insurance to bypass NHS waiting lists. If this trend continues, will universal healthcare remain a reality in the UK, or will the NHS become increasingly fragmented, accessible only to those who can afford it? While privatization may offer temporary relief, many fear it could undermine the very principles of the NHS, equality and fairness. The question isn't just about whether privatization will help in the short term, but whether it will erode the NHS's core values and widen the gap between those who can pay and those who cannot. What does the future hold? Can the NHS be saved? Yes, but only with bold reforms, increased investment, and a fundamental shift in how healthcare is managed and delivered. Staffing is key. Retention must be prioritized, addressing burnout through better working conditions, fair pay, and mental health support. Expanding training programs, reducing barriers for international medical professionals, and creating incentives to keep skilled workers in the NHS must be top priorities. Social care reform is another critical area. The backlog in hospitals is partly due to the lack of care available for patients who no longer need intensive medical attention but have nowhere else to go. By investing in social care, more care homes, better community support, and a streamlined discharge process, we could free up thousands of beds and alleviate pressure on A&E in hospitals. Technology and infrastructure also need urgent attention. The NHS still relies on outdated systems and inefficient booking processes. A push towards digitization, AI-assisted diagnostics, and automated patient tracking could reduce inefficiencies and speed up care. Funding is essential, but how it's spent matters as much as the amount. Increased investment must go directly to frontline services and long-term improvements, not just temporary fixes. Public engagement is critical too, encouraging responsible use of NHS services, such as opting for pharmacies or urgent care centres instead of A&E for non-life-threatening issues, could ease strain on emergency departments. Preventative care and better health education can help reduce the number of people needing urgent care in the first place. All of these solutions require political will. Without long-term, cross-party commitment to NHS reform, the system will continue to lurch from crisis to crisis. The question is, will leaders step up before it's too late? The NHS is more than just a healthcare system. It's a symbol of fairness, care for all, and a cornerstone of British values. But right now, it's at a crossroads. If we want to keep it from collapse, the conversation must continue. Contact your representatives, support healthcare workers, and stay informed. The future of the NHS depends on action today. If you found this video insightful, don't forget to like, share, and subscribe for more in-depth discussions on the biggest issues affecting the UK.